Tim Dempsey, one of the first-year pulmonary and critical care fellows here at Mayo Clinic.
I'm Paul Scanlon. I'm a consultant in pulmonary and critical care medicine and medical director of the pulmonary function lab here.
And together we co-authored a review entitled Pulmonary Function Test for the Generalist, a brief review that is going to be published in the June issue of Mayo Clinic Proceedings. Basically, this is a high-level overview of the basic pulmonary function tests that we believe are important for primary care physicians to know. These include things like spirometry, lung volumes, and diffusing capacity. Throughout our review, we discuss these different tests and also use an illustrative case to go through them. We also describe the different patterns that are commonly seen in pulmonary function testing, including obstruction, restriction, and two other newer patterns that are really described here at Mayo Clinic, including the nonspecific pattern and the complex restrictive pattern.
We have a large laboratory here, and we tend to observe a lot of things in greater numbers than smaller labs might. So over the years we've observed these patterns that were not previously described, and in 2009 we published the first article that was described the nonspecific pattern. It's not a very catchy title, but it describes about 10% of all complete pulmonary function tests, and it's a useful pattern to understand. It's been pretty well received in the pulmonary community. And there's another pattern, this complex restrictive pattern, that describes about 4% of all tests, or nearly half of all restrictive cases. And again, it wasn't described previously, so we did these 3 articles describing these 2 entities, and it's been useful in insights into how to interpret and what the clinical consequences of some of these patterns are. For example, with both the nonspecific pattern and the complex restrictive disorder, they're not just simple restrictive patterns. In fact, they commonly suggest an element of what we call occult obstruction, or some kind of chest wall or neuromuscular disorder that might be missed otherwise. So they can be quite revealing in patients that have unexplained dyspnea.
So aside from discussing these, which we believe are quite important for people to know about, we also walk through a general algorithm of how we should interpret pulmonary function tests. And we think that this is a really important step for primary care physicians and other general physicians to know about, so that when they get the results, they can potentially interpret them and help with their patients. Dyspnea is a very common symptom that primary care physicians see, and so it's really important for them to understand when to order pulmonary function tests, how to interpret them, and what to do with the results. And hopefully they'll get that from our review.
Yeah, the interpretive algorithm we find particularly useful. The standard interpretive algorithms are a little bit harder to use. This is, although it includes more detail, it's a little bit easier to use than the standard interpretive algorithm.
And then to finish, we created a list of questions that we think help to summarize what we hope people will get from the review. And so those will be available after the article for CME credit. Hopefully people find this useful. We did, so.
Thank you very much.
Thank you.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.